Okay. Hi there. My name is Dr. Ngozi Onoha. So I wanted to do this recording on specifically on tuberculosis because apparently there's lack of information about tuberculosis and what it is and what it does and how to look for it. And so just looking at my notes here. Nigeria is the most populous country in Africa with about 200 million people. So, by virtue of that population, you will find that any disease in Africa tends to be higher in Nigeria because of the population. So, Nigeria is the number one country with people living with tuberculosis. So, we call it TB. So, TB is short for tuberculosis. And in Nigeria, because of Lagos as a dense mega city with over 20 million people, you will find again, by that same analogy, that Lagos has the highest number of people living with tuberculosis. Okay, so I'm just going to explain how tuberculosis or TB can come to light. First, it's screening of people without symptoms. So, for instance, if someone, for instance, needs immigration physicals, they will have to have a TB test, or they need a job as a domestic help, or even healthcare workers are screened for TB. And so TB, which could be asymptomatic, meaning it does not have any symptoms. So the person feels well and doesn't have any symptoms. And they're screened for these routine things that I mentioned, and then the TB comes to light. And the second way that TB is found is when a person has symptoms. So symptoms are things that are not normal for that person. So there's been a change. For instance, there's cough for about 2 weeks, often with phlegm, what we call sputum. And somebody will say, what is sputum? What is phlegm? So it is that mucus that comes out from the lungs or from the air pipes when a person coughs. And cough is the body's way of trying to push out some of that mucus that is stuck in the air pipes. So that mucus that comes out of the lungs when a person coughs is called sputum or phlegm. The other symptoms a person with TB might have would be weight loss, sweating, especially at night. The bedclothes might be soaked, or the bed sheets might be soaked. And also, the person might have fever and just feel just generally unwell. Other signs include swelling of the abdomen, also might include swelling of lymph nodes in the neck, typically. And so those are some of the symptoms of TB. So how is TB contracted? So a person with TB who has a cough can spread TB through the air. So basically, by sneezing or coughing, that person can spread TB to someone nearby. So people with cough should cover their cough. So cover cough with or sneeze with tissue, and then discard the tissue in the rubbish bin. So all right, so we talked about the symptoms, we talked about the diagnosis. No, we didn't talk about the diagnosis. So a person with cough for 2 weeks living in Nigeria needs to go to the TB center to be tested. So TB, which is tuberculosis caused by a bacteria called Mycobacterium tuberculosis, is curable and is treatable with medications. So the test for TB is a test called xpert, and it takes 2 hours to test the sputum. Also, a chest x-ray might be done, and that is what to expect, really. If a person's chest x-ray is normal, but their TB skin test is positive or their blood test is positive, it means that they were exposed to tuberculosis, but they did not actually get active TB. So the body contained that bacteria. So the lungs contained that bacteria. So the person did not actually develop tuberculosis, but they have a condition called latent tuberculosis infection. So we call that LTBI. So latent tuberculosis infection. And so that person needs to be treated with prophylactic medication. If they're not treated, then maybe decades from the time they were exposed, they can actually have full-blown active tuberculosis. So we usually recommend treatments of people presenting with latent TB infection. This means that they were exposed to tuberculosis, but their body contained it, and they have in their blood evidence that they were exposed, even though they do not have active TB. But that latent tuberculosis infection can reactivate at any point in their lives. And it could happen when they're elderly, because an elderly person has a reduced immune system and is prone to recrudescence of infection. So infections that have been laying dormant can all of a sudden manifest when a person is elderly. And so I've kind of given you a very brief synopsis of tuberculosis, why it's important. People with HIV and AIDS have a higher risk of tuberculosis because their immune system is weakened. So also children who have malnutrition have a higher risk of tuberculosis. The other issue with tuberculosis is that the TB can spread from the lungs if not treated, can spread to the abdomen, the kidneys, the brain, the lymph nodes, the spine, the joints, and the heart. And I think that is pretty much everything you need to know. The good news is that TB is curable and treatable. And the good news is that in Nigeria, there are centers that will test and treat if a person has tuberculosis, and they do this for free. Thanks so much for watching. Have a great day.